Welcome back to the Care Collective podcast, a place to help caregivers feel seen, supported, and a little less alone. Here we have honest conversations about the emotional, practical, and often unexpected realities of caring for someone you love, while also remembering that you matter too. Today I'm joined by Bree, also known as the Caregiver Pharmacist. She's a geriatric pharmacist who was inspired to begin educating caregivers after watching some things happen in her own personal life that we'll talk about in this episode. In this episode, we talk about why caregivers are such an important part of the healthcare team, how medication side effects can sometimes be mistaken for new medical conditions, and the questions you can ask to better advocate for your loved one. We also discuss polypharmacy, deprescribing, pharmacogenomic testing, and why tracking even small changes in your loved one's behavior or health can make a huge difference. This episode is for educational purposes and should not be replaced by personalized guidance from your loved one's medical providers, but my hope is that it helps you feel more prepared and confident the next time you walk into an appointment. So let's get into this conversation.
So I am Bree. I am the caregiver pharmacist. I am a mommy of two little ones. They're my pride and joy. I'm a wife. I have a wonderful husband. He's fabulous. And actually, that's the reason why I kind of started my account was because I watched my husband struggle with a caregiving journey when his dad was diagnosed with lung cancer and he struggled for a good 5 years, went on hospice, and just seeing the progression of events. And I felt like people like my husband needed the information that I was able to provide. So basically I'm using the information within my profession. I am a geriatric pharmacist. I basically review medication regimens of older adults every day, very complex patients, and I figured that what I know can really help the caregiver base. So that's just a
Yeah.
little bit about me.
Yeah, no, and I love how you're taking your personal experience and gaps and things that you noticed would have been helpful to know and trying to now share that with other people. And I'd love to kind of hear, I think that was what was interesting about our initial conversation was hearing everybody has complaints about the medical industry and things that could be better and
Yeah.
the gaps that are there. But I think you've really seen that there's a gap surrounding medication education, like how we should be utilizing these things, what questions to ask doctors. Can you ask a
Yeah.
pharmacist some of these questions, right? So, what are some of the
Yes.
things you kind of noticed, even professionally, combined with kind of your personal experience in watching this?
So I think there's a huge gap in communication. And
Mm.
I think that our healthcare system is so strapped for time that we really can't sit down with folks and have a conversation and answer all these questions. I feel like healthcare providers are being jammed with patient appointments. There's so many that we can't sit down and have these conversations that are so important. So, even when a caregiver picks up a prescription at a retail pharmacy, that pharmacist I know firsthand is so just strapped for time. Like their corporate overhead is insane and they're just being pushed to get 100 vaccines in per every 2 days, and it's hard for them to just talk to someone and answer these questions. So I figured that kind of an account that I have, I can get information out there while folks are just scrolling on their phones.
Yeah, no, I mean, I think back to the last time I was picking up medicine from the pharmacy and they're like, "Do you have any questions?" And I'm like, "I don't even know what questions
Yeah,
I should
it's
ask
kind
now."
of intimidating. You're
Yeah.
what questions should I have, right?
Yeah.
So
There's something I don't know about this that I should be scared of
yeah,
this about it, like it kind of,
right,
I don't know.
right. And every time, a medication is added, there's added risk, right?
Mm.
And I don't think that's something that we all understand. I don't think that the general public understands that when a medication is added, it's either it's going to help or it's going to hurt, right? And if something isn't helping, then we need to kick it to the curb because it's just going to add side effects to, your loved one's life and to your life, right?
Right.
So there's a lot of hospitalizations that happen from just being on medications that aren't necessary. And that's
Mm.
a big part of my job is to kind of finding the ones that aren't doing their jobs, right? And kind of saying, "Okay, doc, let's try to deprescribe this one. Let's work towards that because I don't think it's really helping them. I think it's more so hurting them." And it's
Sure.
hard to identify those side effects as a caregiver, for sure.
Sure. Yeah, and I think that's the biggest thing I hear from caregivers is not knowing how to advocate or what questions to ask.
Mhm.
Feel like they can't be informed on these topics. So
Mhm.
what do you kind of encourage people to do to know how to communicate with their doctor about these side effects, or I guess knowing and trusting their gut, whether it is something they should bring up or just
Mm-hmm.
not a big deal?
So, one thing that caregivers should be doing is tracking changes over time in their loved one, like taking notes on these changes. Because I will tell you that when I look at a patient's chart, the first thing I look at is I try to find like notes that reference the caregiver, like what they're saying. Like it'll say,
Mhm.
daughter is the caregiver, like in their chart, and I'll look to see if like there's any specific notes of what the
Mhm.
daughter says, because that is actually telling me how the patient's doing. Not so much, I'll look at the vitals and everything, like I'll look at the blood pressure, things like that, calcium, potassium, whatever. But that is actually telling me like what's going on with them, like why
Sure.
they're in the office for a visit, right? So the changes over time that caregivers should track. I took notes on this for everybody. So falls, dizziness, any new confusion, sleep changes, appetite changes, mood changes, new behaviors, increased fatigue, and any type of change in their mobility. Those should be like
Mhm.
little notes that a caregiver should take and bring to an appointment.
Sure. And would you say, even, let's say they have a paid caregiver that's helping, or they're in a nursing home, are these the kind of things they should be prompting whoever spends the most time with them to pay attention to? Because I know for some people it could be
Surely.
hard to know these things if they're visiting once a week versus every day, right?
Right, right. That is a really good question, because it's the person that is tending to them the most that will see the changes, that are like familiar with like their loved one's baseline, and will
Mhm.
start to recognize if there's a change. So whoever is with them the most, I would say.
Yeah.
Nursing home's tough, right? Because like I can imagine that the folks that are tending to them daily are strapped for time, and they're trying to document changes for everybody, right?
Yeah. So that definitely gets tricky. And, I know some people live close by and are still there every day. Some people
Mm-hmm.
maybe getting to visit once a month or even once a quarter or something, just depending on what work, can allow sometimes to get away to go travel and visit someone. But I think regardless, it's just being able to pay attention and notice these things. And like you said, taking notes on it, writing it down if you have to. You know, I would imagine even putting a date to it could be helpful. Like, hey,
Mm-hmm.
January, February, I noticed this
Yeah.
changed, right?
Right.
I'm sure even the progression of how things change and how fast it's going could sometimes indicate, bigger things that are going on that even doctors would appreciate outside of just talking about medication here,
Right.
There are a lot of things that people don't necessarily anticipate.
And one thing I wanted to get across is like, and I've even noticed this with myself when I go to a doctor's appointment. It's important that you, as the caregiver, don't try to diagnose. Like, don't go in there
Mm-hmm.
and say, I think my mom's dementia is getting worse. Like, come in
Mm-hmm.
with like your observations, and then they can take that information and kind of steer the conversation. Because if you come in there with that type of opinion, they're going
Yeah,
to take that for what it is, and they're not going to find another solution to it, right? Because
yeah,
there might be it might be a medication that's making something worse, like an anticholinergic medication, and they're not even going to
right.
like look
Or
at that.
UTIs can cause a lot of confusion as well, right? Like, so that
Sure.
could be what's going
Right.
on,
Right.
is a very
Exactly.
common problem.
Exactly. Another I want to mention before I forget, one question I want caregivers to go into an appointment and be comfortable asking is, what is the plan with this medication? What's the plan?
Mm,
Because sometimes a medication doesn't have to stay on board for the rest of their lives. Like they
mm,
can be reassessed annually, like at the least, right?
sure.
And I bring that up because it's like, especially like towards the end of life, I've noticed that everyone gets really good at deprescribing medications. They're like, okay, like let's get rid of the statin because, we don't anticipate this person's going to live that much longer. So why would you be on a statin? Because it's almost like a
Sure.
prophylactic, right? So it's good to be able to ask that question. What's the plan? Because you want to have in mind that like all medications aren't appropriate as we get older. Things change with our
Mm,
body as we get older, and a lot of them become inappropriate, especially if our loved ones are falling and they're on like 5 blood pressure medications. Like we need to adjust that, right? So
yeah. And And maybe the answer to this is simpler than I think it is, but how does it happen that people just end up on, I think you said you had somebody with like 46 medications before that you
Yes.
were analyzing? Like
Yes.
how does that happen?
Kayla, if I like knew
I
the
know it's probably a
answer to that,
complicated
like I just sometimes I look at the, and this is very common. Like I don't want people to think that like 46 medications is uncommon. Like I see this every single day, like multiple times a day, that 30 plus 40, like 29, like that is too many medications. Like that is, and one of my someone that I follow, Death Doc, she's wonderful. If you aren't following her, follow her. She's wonderful. She said this is just a walking prescribing cascade. That's basically what happens is that like it's hard sometimes to identify a side effect of a medication versus a new diagnosis. I
Mm,
think we get a little bit too diagnostic happy that we just throw another medication to resolve that issue that is happening when really it's a drug that's causing it. I'll see this all the time. Like I'll see one of them I see constantly is patients on antipsychotics. And with some
mm,
antipsychotics, you can get like tremors. So then I'll see someone get put on like a primidone, and that is supposed to be for tremors. And that drug causes so many drug interactions. It like induces our
mm,
enzymes and speeds up the rate of metabolism of most of the drugs that we take. And it's that
mm,
makes them work less. And then this whole thing just like spirals. Just little things like that. It only takes one drug to like change everything for somebody. And
yeah,
I think that we need to do a better job of evaluating the risk versus a benefit. If it's not helping somebody, it's hurting somebody because no drug is perfect. Every drug has side effects. And sometimes the side effects are more pronounced if after we like add another drug
sure.
or our loved one becomes dehydrated, little things. It just takes little things to see the sequelae of one drug. And then when you're on
Mm,
46, I just want to start over at that point, honestly. And it's hard to
yeah,
because a lot of the drugs need to be tapered. You can't just stop them cold turkey. So then you have to
right.
go through the tapering and you have to change the dose of each one. And then the caregiver has to go pick up all these different doses and you have to deal with the insurance companies. It's like, why are they on the 10 milligram now? And it's a mess. So if we can avoid these cascades, that would be good. I might be
Mm.
out of a job, but a lot of people would be better off.
Absolutely. And, I've even seen that on my side of things, just from the doctor recommending certain medications. Then a doctor finally ran a blood test and figured out that I'm pretty vitamin D deficient, and that could potentially be causing a lot of things
Yes,
rather than prescribing a medication trying to treat the symptoms for it,
yes,
So I think there's a lot to be said about how many small things people don't realize can add up
realize.
and
Hmm.
compound. Like it could be one small thing. It might not be the worst possible thing. I think a lot of people go into doctor's appointments and not want to expect the worst possible thing, but it's
Hmm.
natural to go to that. It must be Alzheimer's, it must be Parkinson's, it must be cancer. Like, you jump to these extremes, and sometimes you just got to start with, okay, maybe you need to take a look at your vitamins, right? And see,
Right.
not saying that can solve everything, but is there a bigger picture of what's going on before we just start automatically prescribing medication?
It could be a simple resolution, right? It doesn't have to be so complex to add like an entire prescription. I made a comment on someone's post the other day, and they commented back saying, if we're gonna add a med, like this is what I heard in med school, if we're going to add a med, there better be a damn good reason for it. And that's kind of like my path, because the first thing I learned in pharmacy
Mm,
school, one of the first things, and I won't forget it, is that drugs are selective poisons. They really are, because they're changing how our body would naturally function, right? Sometimes
mm,
that is a good thing, right? I'm not anti medication, but if you think about it, that's how drugs work. They change how our body is functioning. And sometimes that's a really good thing, right? So, someone that has epilepsy, obviously, we don't want them to have seizures. So, let's give them a medication that prevents these seizures, right? But it is
sure.
changing how our body is functioning. These drugs have side effects. They all do. We just have to find the right one for the right patient, right dose, all
Well, I
that
think
good
that's even another point you're making there too. Is I know even people just talking about antibiotics and how that's been a whole nightmare.
stuff.
People not taking it correctly, So how much are we seeing that change over time, even just in other types of medications because of misuse or overdependence on it? Like, are we creating more havoc in some ways because of the ways we're using medicine right now? Or do you think you see that kind of getting better as we've kind of educated people on that more?
I think we are getting better at it. I really do. I think that more people have the mindset that I'm trying to get across now is it's there better be a good reason why we're adding this medication.
Mm,
I don't think that most are prescribing happy. I think they see that added risk now that like more information comes out on medications. I also think the general public is more aware of things now, especially since
hmm.
social media. I think there's definitely a lot of fear mongering, and that's actually starting conversations in doctors' offices, you know, a big one right now is, you know, statins, like statins causing dementia, statins causing this, causing that. I'm not getting into that right now, but that's a big one.
Yeah,
But yeah, I think the general public is just getting more aware. And so I think there's more pushback now from
sure.
people.
Sure. No, that makes sense. Yeah, I think that is one good thing that has come about with the age of information, I guess, if you will, is being able to make people more informed. And I think it comes at a risk of, like you said, don't walk in thinking you've diagnosed yourself or your loved one. But, if you know the diagnosis and you're able to research these options, then that can definitely help as far as feeling more informed when you go into an appointment, asking questions about the medications. Okay, are they going to experience this side effect? Do I need to watch for this so that we can change medications?
Mhm.
And letting multiple people, if they're around more than one person, even aware of this situation so that they know, hey, can you just let me know if they seem a little dizzy in the morning, right? Or if
Right.
the fall, and obviously that's a big one that lots of people would notice.
Yes.
But just making sure everyone is informed so that you're making the best possible decision for your people. And ultimately, I know people are doing the best they can. So,
Yes.
not trying to shame anybody if they already feel like this is one more thing on top of their plate.
Yes.
But I think you're just saying you can see a huge difference when people are educated on these medications and can make better decisions about it.
Yes, exactly. I think that the stronger that you are as an advocate for your person, the better off that they will be. Not to put additional pressure on the caregiver, but they are the most important person in that room. When you're going into an appointment, they are the most important person in that room. And I think that they need to take that perception of themselves like seriously.
Right.
Not to add
Right.
pressure, but they really are because they are helping that patient. They're translating all this medical jargon, trying to all the medical jargon to the patient, and they're the overseer. Like they're the boss of the whole operation, like in making sure this
Mhm.
person's okay, right? And that's a lot, especially when you're in the sandwich generation, you have your own kids and you're taking care of your parents and you have a career, and your thoughts of like what your future was going to be like isn't happening, and you're dealing with that emotional stress. That's tough. Like you're the strongest person in the room, and you're the most important person in that room. So it's just, I'm hoping that I can help people get more prepared to be in that room, right, with
Yeah.
dealing with all that emotional stress that they have.
Yeah, no, it is. And I think just understanding the emotional side of it and knowing that when you're super stressed out, I think that logic is the last thing that you're thinking
Mhm.
about.
Mhm.
Also, anxiety or that stress is literally the fear of not being able to control things, of not having information. At least I've found that when I'm able to give myself more information, then the anxiety can make sense of what it's going to, right?
Mhm.
So I think to your
Mhm.
point, even you can go into this appointment armed with the facts and having a better sense of what's going on. That's going to help you push the emotions aside and focus on, okay, what is the job to be done here? What can I focus on? How can I help this person? Whatever your goals are, maybe at this point it's keeping them comfortable until the end of their
Mhm.
life. Maybe the goal is so that they can get better and live on
Right.
their own. Whatever that kind of looks like for you, I think even just knowing that kind of plan and how to get there offers so much more relief on the emotional side of things.
Right. Yep. 100%.
So I know the other thing that you like talking a lot about is the genetic side of how that plays into
Oh yeah.
medicine. And so
Absolutely.
can you talk a little bit about that? And I think there's a lot of things that could still be done, to a lot of research to help educate people on this as well, even. But I know something you're passionate about, so I'd love to hear kind of
Oh, for
where
sure.
things are right now, and
I'm
tell us more about that.
definitely I'm a chatterbox when it comes to this. I haven't posted a ton of it on my social media yet because it's kind of a tough topic to talk about and get people interested in because it's like
Right.
I just think it's very complex. So I'm going to try my best to like put it out there to everybody. But so pharmacogenomics. So one of the things that I do is I do pharmacogenomic consultations, and that is essentially getting a genetic panel for somebody to see how their enzymes are working in their body. We're all different,
Mm.
right? So some of our enzymes in our liver, they are primarily responsible for breaking down the drugs that we take, and everyone doesn't have the same type of function of these enzymes. So
Yeah.
what I do is I look at the function of your enzymes, if you're a poor metabolizer or if you're a rapid metabolizer, and I can figure out, okay, maybe this drug isn't the best for you because it's being broken
Mm.
down by this enzyme that's metabolizing it super fast, and maybe you'd be better off on something else. So pharmacogenomics is basically one way that we can get to personalized medicine. And I think this is important, especially in the older adult population, because what we see with older adults is rampant polypharmacy.
Mm.
And the polypharmacy ends up and translates into hospitalizations for these patients because
Mm.
too many drugs, too many side effects, too many drug interactions. What PGX can do, pharmacogenomics can do, is help to eliminate some of this trial and error prescribing that we currently have. And I love that. So I can say, okay, maybe this antidepressant for, Mrs. Jones isn't the best pick for her because she's not going to be able to break it down and she's going to experience more side effects than Mr. Jones, right? So
Mm.
that's what it helps me do. And I love it. I think it's just extra insight into someone's day to day. I use it as an extra lab result. I don't rely on it. I just look at it as just an extra piece of information that we wouldn't normally have. And it actually really does help a lot. So, for instance, my patient yesterday, she is a poor function SLCO1B1 or SLCO1B1 poor function. This means that the transporter that would take your statin into your
Mm.
liver for it to do its thing, because that's where it works, it works in your liver, isn't working. So essentially, her atorvastatin that she was taking is basically going through her bloodstream, creating all this muscle pain and weakness that she's experiencing, and it was making her uncomfortable. It's painful. She was like, I don't want to take my statin anymore, right?
Right.
So there's other options for her than her atorvastatin 40. We don't have to stop her statin. We can change her to another one that would have been better and less dependent on this whole transporter process happening. So
Yeah.
that's what I do weekly. I love it, and I'm hoping that it just branches out a little bit more and more people are in tune with it, because I don't think a lot of providers are. When I talk to providers about it, they're kind of like, "What are you saying?" Like, and I'm like, "Ugh, like I really wish you like knew
Right.
about like we're more familiar because it could really help like your prescribing, right?" So yeah, that is a big part of my day to day, the PGX stuff.
Right. Because I mean, how I would guess on a daily basis, 90% of what you're seeing is people just having to guess what medication works until you find the
Right,
right combo. And
right.
that's what that's aiming
That's the
to
trial and
reduce.
error, right? And like, so they'll be on a medication and then they'll have side effects, and then we'll diagnose it as a disease state, right? And it's really not. When
Right.
I could just say like, okay, well, this medication might cause side effects in Mrs. Jones, so let's change it. Let's do this one instead, right? Instead of us trialing the one that's going to cause the side effects, and then we have to go through the whole tapering process to get her off of it. It's just a mess.
Right. Yeah. My dad's a nurse practitioner and he always likes to say whenever I'm like complaining about something medical, he'll be like, "Well, we do call it the practice of medicine because none of us know what we're doing and it's all trial and error. We're all learning and what works for one person may not work for another, so it's not an exact science where we I mean, obviously there's some medications that okay, you have a headache, I'm going to go take some Tylenol or ibuprofen, right?
Right.
Counter drugs, or I'm sure there's other medications that it's known take this for that. But
Yes.
still, and like you're saying, when you get so many combinations of things, especially as you start to age and you're on 46 medications,
Hmm.
there's no telling anymore what your body is going to do, and
Right. It's
like
like
you're saying
your
that.
stomach's upset. They're complaining that that patient came to me and said, "My stomach's upset." I'd probably say, "Well, it's probably because you're on 46 medications, not because you have GERD." right? Not because you have
Right.
reflux, but because you're on 46 medications. You're putting 46 like different chemicals in your body, and then some of them you have to take multiple times a day, right? So like
Right.
you imagine, right? Like one of them, you might have to take 3 times a day. It's like that's crazy. And then there's a caregiver that has to manage all of that and pick all those prescriptions up. Where I
Well,
work, the pharmacy, what we do is we do like pill packs. So it's like you get like a whole pack and it's like a 28-day. And then there's like
sure.
a time Monday. Yeah, Monday, well, weekly, and then, morning, noon, evening, bedtime, right? And it keeps it organized. So if you're on 46 medications, like it'll keep it organized for you and it comes in the mail, right? Delivered to your doorstep, easy peasy. So those caregivers are somewhat lucky, I guess, but the others that have to pick up the 46 medications at the pharmacy every
Fill
month
the little pill box every week. Like it just.
and then has to deal with all the refills. Could you imagine dealing with the refills for 46 medications, making sure they take them? I can't imagine the patient that had the 46 medication is taking them. But like if we want to talk about adherence, I mean, maybe let's try to get rid of some of the 46 because God knows she doesn't
Sure.
need those, right?
Well, that's what I was going to ask too is how many people do you even run into that, which I know you only talk to the doctors that talk to the patients, so you don't necessarily talk to the people
Yeah.
themselves, but I imagine even the psychology of that, developing a codependence or thinking, oh, I have to have these medications and being scared to go off of them could even be some of why a
Oh,
doctor has a
yeah. Oh,
being
yeah.
like, oh, no, I have to take this. I've taken it for 20 years,
Yes,
Okay, well, I
I've
might
been
be
taking
taking
it
it.
for 20 years. Like, I don't want to stop it now. I don't want to experience what that's going to be like, right?
Mm,
Yeah, that's a big barrier to like deprescribing in general. Huge, huge,
right.
huge, huge. And and I don't just see it with things like controls, like a benzo, right? Like, which I understand. I get the benzo thing. Like, if you've been on something consistently your whole life, like that,
Mm-hmm.
that's like your baseline, and that like changes. That changes you. It really does. But like things like PPIs, like, and that one, the PPI thing is another topic next to the statin thing. That's just like man, but people get attached to certain medications of theirs. Like I'll see, a lot of hoarding happening. Like I'll see notes to say, don't dispense this, like because this
Mm,
patient has like 3 months worth that they
sure.
have, right?
The emotional codependence of thinking I need to have
Yes,
this medication, this is what I'm
yes,
used to. That's the
yes,
kind of thing we psychologically don't want to see happen either to people, which I think is what happens
yes.
when it's easy to just get busy.
Mhm.
Oh, this is working out okay, anyways, moving on.
Right, right. Yeah,
uh,
100%.
so I guess, all in all, if somebody is going into this appointment, I know I've heard somebody else, one of our other friends, Lauren, talk about how, it would be a good idea for people to have straight up a doctor's appointment to go over medications. Like that is the sole purpose of
Yes.
that appointment is to review that. What other kind of recommendations do you have to kind of set as kind of a guardrail, I guess, to make sure that you remember to review these things or ask these questions or what questions should we be asking?
Sure, sure. So I took a ton of notes on this because I just want to make sure I'm getting everything across
Yeah.
clearly. So I think I came up with my top questions that I would want caregivers to feel comfortable asking. So I'll just go through them. I'll do rapid fire and then you can let me know what you think.
Yeah, of course.
Question one. So, what is this medication for? Plain and simple. What is this medication for? Why are we on it? Because a lot of times I'll see people on medications and they don't know why they're on it.
Mm,
And there might not be a real reason for it, right? Like it might have been a medication that was added
right.
in a hospital or at a rehab and they just like thought that they needed a refill for it, so they got a refill for it and now we're on this medication. And it's like
Mm,
why. If it's not helping, it's hurting. It's one big thing. So, is this medication still needed? That's a huge one. I think all caregivers need to be comfortable with that one because that's
right.
like you're questioning the doctor's practice, but it's not because you just want to be informed, like, and you don't want them to
Right.
take anything that's not necessary, right? It's not helping, it's hurting. Number three, could any of these medications be contributing to what we're seeing? So, like, if you have that list of side effects that we talked about, or not side effects, of observations that we talked about in the beginning,
Mm-hmm.
could any of the medications be contributing to what we're seeing? Because that one is leading into listen, I don't want you to prescribe something if we don't need it, right?
Sure.
We don't need something else added if it's not necessary. So, number 4, what should we expect this medication to do, right? So, and when should we expect that to happen, right? Because some medications take a longer to work, some should work right away. And with that question, it should be, what kind of side effects should we expect and when should we expect them? Because some side effects can happen within an hour or a couple of days or weeks or months or after another medication is added, right?
Sure.
So we want to be comfortable with those 2 questions. What side effects should we watch for? I basically just said that. What is the biggest thing we should focus on right now? So if like your person has multiple chronic conditions, usually there's 1 or 2 that trumps the rest, and
Sure.
that's important for a caregiver to know, right? You don't have to be a doctor, you don't have to be a pharmacist, you don't have to be a pharmacologist and know how all the drugs work. You just really need to know what questions to ask at the appointment.
No, I like that because I think that what strikes me about a lot of those questions, I think that a lot of providers will get in the zone where they have like their favorite medications or because they're in a rut where they're like, I always like prescribing this one for this condition, right? And so I think those questions to me almost come across like, I'm going to put you on the spot. Like, what are the reasons why I need
Right,
this?
right.
Can you
Exactly.
explain it to me to make sure that they're actually thinking through the logic behind why we're
Correct.
prescribing this than to be so quick to push it on you?
Correct. Because you're sitting there, right? And within 10 minutes, if they prescribe something, it's like, okay, like,
Right.
are we sure? Right? Like, and you said it, like doctors, and I'm not pointing fingers at anybody. I'm just saying what I
I
noticed.
know they got bigger problems and they're going to
Yeah.
find shortcuts.
I brought this up to my team last week that so I help different PACE facilities.
Mm,
And it's very interesting to see the trends of prescribing between the different PACE facilities. And you can tell what the prescribers are comfortable with prescribing. Like, I swear, there was one facility, like 5 of the patients that I reviewed, their medications were like identical. They had
mm,
different like disease states, but the medications that were on board were identical. And I don't know if they were started prior to joining PACE,
sure.
programs of all inclusive care for the elderly. For those that don't know, to qualify for that, 55 years of age and older, and you qualify for nursing home care, but your caregiver wants to keep you out in the community rather than be in a nursing home.
Sure.
That's what PACE
Yeah.
is basically. But they're all on the same medications, like, and it's just like,
Mm,
like it. Do they need to be on this? Like, does Mrs. Jones have to be on the same thing as like Mrs. James,
yeah.
right? Like, we try to get personalized, and some of it is just it's all about what you're comfortable with. Sometimes it seems like in terms of prescribing.
Right. Right. No, and I've even seen that when got prescribed something, left the appointment, Googled the medication, and realized I think there's a reason I shouldn't be taking this. And
Hmm.
ended up deciding not to take it at that time, moved, changed doctors. They were recommending kind of a similar medication essentially. So I brought up, hey, before this doctor tried to prescribe this for XYZ reason, I didn't think it seemed like a good fit because of, things going on. And they were able to clarify and educate. I think I have a great nurse practitioner that I see now. But, anyways,
Hmm.
educated more on the medication, was like, you would have been totally fine taking that one. Glad that you looked it up though,
Yeah.
and we're trying to be informed about it, but that would have been okay. So, but we can go a
Hmm.
different route instead if that makes you feel more comfortable because
Hmm.
but
I
I think
love
it's even
that.
just taking that time to explain it and not acting, which I get. We all have personal things go on in our lives and show up to work sometimes is not our happiest best self,
Yeah.
so I don't fault anybody for having a bad day occasionally. But this other provider that was even over multiple visits, I kind of had similar experiences time after time,
Gotcha.
just
Yeah.
feeling very rushed. Things were not done properly.
Yes.
Anyways, could go on
And
about
that's such a
that. So I
shame,
think,
right? Like, that's a huge that what you're describing is just a huge problem with the healthcare system in general. It's not the
when it builds a
individual
trust with the
providers, it's just
provider,
the system,
if you
that
can slow
they're
down
working
someone's trust, they're going to be willing to do anything that you
in. Hmm.
say. If you're going to listen to their concerns and then address it rather than just shutting it down and being like, nope,
Right.
you should just do it just because.
Yeah.
Okay,
Yeah.
how does that help me?
Right. Yeah, like the can't be bothered attitude is a huge problem, but they need to be bothered.
Right. Right. And so I think, like you said, it's learning how do I bring up my concerns in a way that they're going to be heard? How do I make them slow down? Because I acknowledge too that, while I was able to move and find a new provider, maybe this is the one specialist on your insurance. I saw a video of a girl the other day that was saying she wanted to see a female OBGYN. Her insurance only had 6 approved OBGYNs in the whole New York City is where she lives also. So that alone is wild to me. And I think, 4 of the 6 were men. So that left her with two
Really?
options. And so she's like, if I don't like one of them, well, if I don't like both of the women that are on my insurance plan, I guess I'm just going to have to go pay myself for that. So I get that for some people, you may not have the option of shopping around to find a provider, or maybe you just need whoever's the closest, or if they aren't a nursing home and you get the person that comes to them, like I
Yeah,
get sometimes you have limited options. So that's what I like about your list too is, how can we, regardless of the circumstances we're in, still ask these questions and advocate for ourselves, for the loved one,
right.
no matter what kind of situation you're thrown into, because we can't
Yes.
control that all the time.
No, no, sadly, we cannot. We have to work with what we have. So hopefully, we get these caregivers prepared, right?
Yeah, no, absolutely. Well, I cannot say enough thank yous to Bree for coming on and sharing about her experiences and ways to just help caregivers more. I hope today's conversation reminded you that you do not need to have a medical degree to be important and effective advocate for someone you love. You are often the person who understands their normal routines, behaviors, moods, and abilities better than anyone else in the room. And your observations matter. Writing down changes, bringing an updated medication list, and asking simple questions like, what is this medication for? Or could any of these medications be contributing to what we're seeing? Can help create a much more productive conversation with your loved one's healthcare team. And as Bree shared, asking questions does not mean that you're challenging or disrespecting a provider. It just means that you're trying to understand the plan and make sure every medication is still serving a clear purpose. You can learn more about Bree and find her caregiver medication education through the link in today's show notes. Thank you for listening to the Care Collective. If this episode helped you, please share it with another caregiver who may need it and follow or subscribe so you don't miss future conversations created to help you feel more informed, supported, and less alone. Until next time, remember caring for someone else should never mean completely losing yourself. We'll see you next time.